Morning sickness is one of the common signs or symptoms that you experience during pregnancy, and a lot of pregnant women experience this during pregnancy. Hello, welcome to my channel. My name is Bevelyn Ofori, and in today's video, we are going to talk about some of the things or the tips that you can do to treat or control morning sickness during pregnancy. Remember, there's no standard treatment or magic cure for morning sickness, but there are several things that you can do to help you manage your nausea and vomiting or morning sickness during pregnancy. You can manage your morning sickness during pregnancy through your diet, through medication, and also through some coping mechanism skills. Let's start with the diet. Most of the time, morning sickness can be triggered with what you eat. So when it comes to managing your morning sickness, it's very important to consider what you are eating, when you are eating, and how much you are eating. This is going to help you manage your morning sickness. These are some of the things that you can do regarding to your diet to help you manage your morning sickness during pregnancy. The first one is consider ginger tea. Research shows that taking up 1 gram of ginger daily is safe for reducing morning sickness during pregnancy. You know that ginger can be sometimes spicy, but not very spicy. So when you are experiencing morning sickness, especially when you are feeling more nauseated during pregnancy, you can make yourself some ginger tea. All right, you can make yourself some hot ginger tea and sip it slowly. This will help reduce your morning sickness. The second one is prevent an empty stomach by eating small, frequent meals. Because how much you eat have an influence on your morning sickness, remember that you don't have to keep an empty stomach. But if you feel like your morning sickness is worse whenever you eat, then you can eat, but make sure that you are eating in small quantity. That is, you will have your meals frequently, but in small quantity, so that you don't eat a big bowl of meal. If you do that, you can trigger your morning sickness. So what you can do is that you will eat your food frequently, but in small sizes, so that your body can get time to adjust with those meals to help prevent you being nauseated or vomit after your meals. The next one is you should also avoid food and odors that trigger your nausea or make it worse. Sometimes some food or some smell can trigger your morning sickness. If you are aware of the things that when you smell, you feel nauseated, or foods that you feel like whenever you eat them, you become so nauseated or you vomit, make sure that you avoid those kind of food. And also you avoid odors or things that trigger your nausea and vomiting. It's very important to stay hydrated during pregnancy, especially when you are experiencing nausea and vomiting. You know that you lose some fluid whenever you vomit, and you have to replace them by drinking water. But sometimes when you drink a lot of water during pregnancy at a go, it can also trigger your morning sickness. So what you are going to do is that you make sure that you stay hydrated throughout the day. Drink water is very important for your health and the health of your baby. But avoid drinking a lot of water at a go or at a time, which can trigger your morning sickness. Also, avoid drinking water with your meals, or avoid drinking any form of liquid with your meals. Some people tend to vomit whenever they drink water together with their meals or any liquid whenever they are eating. Make sure that you avoid drinking water or any fluid whenever you are eating to prevent triggering your morning sickness. Also, in the morning, some people tend to experience their morning sickness at its peak. So what you can do is that you can keep some plain crackers or biscuits by your bedside, so that in the morning before you wake up, you can have those kind of crackers or biscuits. This helps prevent some people from experiencing morning sickness. The next one is to skip greasy, spicy, or fatty foods. When you eat this kind of food, it can trigger the release of stomach acid and aggravate your digestive system. Because during pregnancy, there's a lot of hormones which are taking over your body. These hormones have effect on your digestive system. The works of some of these hormones causes your digestive systems to slow down during pregnancy. As a result of that, when you eat food that are very greasy, spicy, or fatty, it can trigger the release of stomach acid and aggravate your digestive system, which are slowed down during your pregnancy, and this can trigger your morning sickness. You can also try the brat diet. Bratz diets are diets that consist of bland food such as banana, rice, applesauce, toast, tea, and etc. It is believed that these kind of foods don't aggravate your digestive system, thereby helping your digestive system, which is slowed down during pregnancy, to cope with this kind of food. As a result of that, it will help prevent you experiencing any form of nausea or vomiting after eating this kind of food. You can also consider taking lollipops, toffees, or other form of sweet. It is believed that having this kind of sweet in your mouth helps limit nausea and vomiting during pregnancy. Now, let's talk about medication that can help treat nausea and vomiting. When it comes to medication, the only person who is allowed to prescribe medication during pregnancy is your doctor. So, with medication, your doctors are going to prescribe it for you if they feel like it's important for them to give you medication to treat or manage your nausea and vomiting. And they are going to do this by considering the severe form of morning sickness that you are experiencing, and also consider your pregnancy and decide whether it's important and safe for you to prescribe any form of medication to help you treat your morning sickness. Some of the medications that they can prescribe to you are antiemetics or anti-vomiting medication. They can also prescribe antispasmodics and antihistamines and other form of medications that they feel like is very safe for you to have during pregnancy to help treat your morning sickness. That is why it's important to report to your doctor or midwife if you feel like you've done everything relating to diet and other form of way of managing nausea and vomiting during pregnancy, but you are still having difficulties with your morning sickness, so that they will know what next to do for you. If they feel like it's important for them to prescribe medication for you, they will do so that it will help you manage or treat your nausea and vomiting during pregnancy. The next way to treat your nausea and vomiting during pregnancy is by using some form of coping mechanism. Beyond dietary changes and medication, there are other several ways to cope with morning sickness during pregnancy. Maybe you'll be doing all these kind of things and you are still having issues managing your nausea and vomiting. There are other ways that you can use to cope with your nausea and vomiting whilst going through your pregnancy. The first one is you can ask for help from your loved ones or your friends. If you know about somebody who experience morning sickness during their pregnancy, you can ask them some of the things that they did to help them cope with their morning sickness. You can ask for ideas from these kind of people. And also, if people that you are living with are doing something that triggers your morning sickness or your nausea, you can ask them to stop doing that. Maybe your partner have a perfume or something that you don't like the smell. You can kindly ask him to stop using those kind of perfume so that your morning sickness can be triggered. The next one is distract yourself. You can go outside to take a short walk so that you can have some fresh air, or you can distract yourself with other things such as watching a movie, listening to music, or maybe doing some sort of mild exercise. This will help distract you so that it will be easy for you to cope with your morning sickness. There are other people who also go the alternative route. Many women find peppermint essential oil to be natural, helpful ways to relieve morning sickness. But remember to talk to your doctor or midwife about these kind of remedies if you feel like you want to go the alternative routes or the natural ways to help cope with your morning sickness, for them to give you the advice so that you can decide for yourself whether you want to use those kind of ways to treat your morning sickness or not before you use them to help you cope with your nausea and vomiting. The last one is to track your nausea. If you are being nauseated, it's very important to track your nausea. The time that you feel like you are more nauseated and the time that you feel like you've been relieved in a way or the other, make sure that you track it so that it helps you decide the time and the day that you feel like you're more nauseated or you experience your morning sickness a lot. And this will help you to manage and cope with your morning sickness. We all know that morning sickness can be very difficult to cope with, but remember that morning sickness fades whilst your pregnancy is advancing. And if you feel like you are still experiencing your morning sickness throughout your pregnancy, try your best to do whatever that you can to cope with your morning sickness. And if you need any form of extra help, or you are still concerned with the extreme that you are experiencing it, remember to talk to your doctor or midwife. And if they feel like it's the need or it's important for them to use other ways to help you treat or cope with your morning sickness, they are the best people to give you that advice and that kind of treatment to help you manage and cope with your morning sickness. This is the end of this video. I hope you enjoyed the video. See you in my next video. Bye bye.